Recording in progress.
What is that?
That's your Zoom. Did you post a link?
How is my mic working? Okay, now is my mic. Hi there. I'm getting some feedback from my sound system here in the classroom. So I was trying to figure out how to, so I won't do much talking.
Okay.
We hear you good. At least I hear you good. I should. Everybody can hear Megan good? Okay.
Let me see. Well, I have a PowerPoint to share with you guys. I just don't know how to share my screen quite yet. Well, there we go.
Do you have the PowerPoint or do you want me to open it?
I do have it. It looks like you might have to accept me screen sharing if possible, though.
Megan, can you see the PowerPoint okay?
It looks like it's loading for me.
And I'm making you co-host, Megan, so you can go ahead and control the slides also.
Okay, perfect. My computer is just taking a few minutes to load. The Wi-Fi is not the greatest here. Let's see.
Megan, did you stop video on your picture?
All right, sorry guys. I think this is working now. All right. Is everyone here that you needed here? Are you ready to start whenever? All righty. Well, I'm Megan. I am one of the child life specialists here at Banner Health Diamond Children's. So thank you all for letting me kind of join your class and kind of talk with you guys about child life. At the end, definitely feel free to ask any questions that you might have. I'm sure I may have worked with some of you if you've had your clinicals here already. But I'll just kind of go through our kind of spiel of child life. And like I said, if you have any questions at the end, feel free to ask. I'll just kind of go over a little about me. I am originally from Madison, Wisconsin. So I actually came to Tucson for this job for child life here at Diamond Children's. I've been here a little over 3 years, and I'm primarily on Diamond 5, which is our general inpatient pediatric unit. All right. So this is a slide about what child life is. As child life specialists, we provide developmentally appropriate interventions, which include therapeutic play, preparation for any procedures, education regarding those procedures as well to reduce any fear or anxiety, and also pain. We work nationwide with patients and families to help increase positive coping and decrease emotional stress and anxiety. To be a child life specialist, you have to have either a bachelor's or master's degree. You also have to have a 120-hour practicum, internship, which is about 4 months. I did my internship at Children's of Minnesota, Minneapolis. You also have to take a national certification exam once you're all done with your internship and all kind of the eligibility requirements. And then we also have to do continuing education. So we have to do professional development. Every 5 years, we have to have a certain amount of criteria in order to keep our certification as well. Perfect, thank you. So here at Banner, we have 4 full-time specialists. We have one on Diamond 6, which is split between our PICU and our hematology oncology. Diamond 5, which is just our regular general pediatric inpatient unit. We have a specialist in the emergency department, the hemonc clinic, and the pre-op area as well. We do have 2 per diem specialists. One of our per diems will be covering more of the PICU and hemonc unit. We also do have a hospital school teacher that works with families as well. And then I just have a few slides just of different kind of responses to different age groups, kind of what to expect with these ages, and kind of different ways to help during that time as well. So first off, we have infants. Infants are very aware of their surroundings. They do have stranger and separation anxiety, and can have anxiety due to either lack of stimulation or overstimulation as well. So it's always great when we do have family members here with infants, but we do know a lot of the times we do have situations where infants don't have any family members. So either kind of taking on that role of being there for procedures, and just kind of having people here, especially when we do have volunteers, to kind of just help with holding them and providing comfort, just so they're kind of getting that developmental aspect while they're here in the hospital. When we do have to do any type of procedures with infants, though, we do encourage parent involvement, whether it's providing a comfort hold for them, holding their pacifier with sweeties, just to kind of help with like a taste and texture, and maybe even breastfeeding sometimes can be helpful as well. And next we have toddlers. For toddlers, especially when we're doing any type of like preparation or education regarding any type of procedures as well, definitely explaining more like short explanations using simple language that they'll understand, pointing to where they might be getting a procedure if they have to get a poke. Definitely vouching for utilizing any type of pain management, whether it's like a J-tip or using the amlodipine cream, a buzzy, and also with that, encouraging parents to provide any comfort holds, providing distraction, and just kind of using those type of aspects to help with those situations and make it a lot easier for toddlers and for families as well. And then preschool, some certain things to expect. Sometimes they might have, magical thinking. They might not fully understand, kind of have different ways of thinking of different things here in the hospital. Definitely using more concrete language. They do have more of a fear of loss of body function, fearful of pain. So it's really important to provide choices when we have anything that we might have to do to them, even giving them choices of what kind of drink they want to have with their medicine, or where they want to sit when we have to do a procedure. It's little things like that that are giving them a little bit of control while they're here, but also providing simple language when we're preparing them, giving them a choice of even participating in the procedure. And that could even just be giving them a choice of what they want to do for distraction, or if they want to hold a comfort item, and just reassuring to them that the procedure is not a punishment. It's something that, we have to do to help our body. Just providing simple language like that as well. And then school age, kind of similar, is using like concrete language. They definitely have a better concept of like how their body works, but they also do have a fear of body function, loss of control, fears body mutilation and death, and modesty concerns. So again, some other ways to help is preparing them if they do have any new tests or procedures, allow them opportunities to ask any type of question, giving them choices. If we do have any like visual teaching tools, like preparing for an IV, making sure that we're bringing in the real medical supplies and engaging in medical play with them. And then also giving them the opportunity to be involved and kind of hands-on during those times too, gives them a little bit of control during that time. And then for teens, we work with up to 18 years of age. So we do still get consult to provide some like preparation for different tests and procedures, sometimes even being there for more support, especially if they don't have any family members there. So sometimes for them, understanding abstract language, understanding their diagnosis, how it may affect daily living, future life. They can be concerned about their body image, pain, loss of independence, and certainly invasion of privacy as well, being here in the hospital. So some other ways to help is, just providing that preparation and education, definitely giving them explanations that they'll still understand, but are at their level. Respect for privacy, include them in any decision making, and again, providing preparation in advance as well can be really helpful. So research shows that children who are prepared for medical procedures experience significantly lower levels of fear and anxiety, better able to cope, are able to build trusting relationships with the medical team, more cooperative, and can typically decrease number of staff needed to perform the procedure as well. We definitely have built good relationships with our nursing staff and still continue to do so when our patients do have any tests or procedures, and having them give us a little bit of heads up of when these things are happening is really important, so that way we can take the time to prepare the patients appropriately, develop a coping plan with either them and or the parents, just making sure that it's a smooth and easy transition, but also releasing any type of anxiety they may have regarding the procedure as well. Preparation is super important during that time. And then providing developmentally appropriate information. So when you are going to be doing anything with the patient, just making sure you're visually assessing for how their reactions are, even when you walk into the room, if they kind of scoot back or kind of snuggle up to mom or dad, if they're crying, if they aren't really willing to engage with staff, or are fearful, you can already kind of assess how to approach certain situations, and that, if you do have to do anything, making sure you're explaining beforehand what you're doing, and at a level that they'll understand as well. And also making sure that asking them how much they actually do want to know. I know for younger kiddos, even talking with the parents, and definitely vouching for providing preparation is super important. There are times when parents might not want their kid to be prepared for an IV or for a blood draw, but also talking with them about the importance of why it is important that we do provide preparation, just so they know what is going on, because having that fear of the unknown can also provide a little bit more stress and anxiety, versus providing preparation can be super helpful, and just assessing developmentally where they're at and what's going to be the best for that. So this is just some different language choices when working with kiddos, of different ways to explain different types of medical procedures or medical things, whether it's an IV or a pulse ox, stretcher. I know sometimes we use these words thinking that, everyone may know exactly what they mean, but especially for younger kiddos, they might have more of a fear of, oh, you're going to put a pulse ox on me. What is that? And why is it glowing? So just explaining that it's a sticker and what the red light means and what it's for. So definitely using appropriate language when explaining certain things. And again, using that assessment of their age level and their development and how much they do want to know is super important to make sure they're comfortable and know exactly what things are while they're here in the hospital, because a lot of this stuff will be new experiences for them. So when we do any types of pokes or procedures, I know we definitely as child life specialists advocate for any type of pain management, whether it's the J-tip, the pain ease spray, which I personally have not worked with. I know there's only certain areas that might have it. We do work a lot with like the EMLA lidocaine cream, but then also the Buzzy Bee as well, to utilize it as a pain management. So that's also why it's helpful to know if a patient is having any type of procedures, so we can definitely advocate for, oh, well, I assessed in my, interaction with them this morning that they had some pretty traumatic experiences with getting an IV before, that I think a J-tip might be helpful, or any type of pain management might be helpful. So being able to have that conversation with the nurse or the residents, whoever it may be, is super helpful, but can also provide a lot of help and relief for the patient and family as well. So for procedure support, these are just some different things we can control during procedures, what we cannot control in procedures, and just some things to think about when going into procedures of, what our voices are like, if they're super loud, if there's a lot of people, if the lights are on and off, the TV, things like that, if we're utilizing pain management. And then also, providing that appropriate preparation of how we developed a plan if we're going to be providing a comfort hold, if we're going to give the child a choice if they have the opportunity for which arm they prefer, things like that. On the right, I think, are things to kind of recognize and try to remember as well, especially for me. I sometimes have to remind myself, like, I can't control this situation, but the family dynamics of things, a child's temperament. We could have, a 4-year-old who in general just dislikes everyone, does not do a lot of procedures, but we're still doing everything we can to give a choice of, a comfort hold, or giving them a choice in distraction, things like that. And we can't control their past hospital experience either, but making this current hospital experience for them, if they have had past traumatic experiences, making this one, a better one, and making the family feel like they are involved and supported during these times as well. So I know I talked a little bit about comfort positions. I'm not sure how much you guys have seen or heard or learned about comfort positions, but these comfort positioning is great for any type of procedure. There's advantages that are kind of listed on the left, but we usually use comfort positions with infant all the way through, if appropriate, even like 10 or 11. It could be older, it could be younger as well, but there's so many different ways for comfort positions, which we'll kind of get through in a few slides as well. But some advantages: successfully immobilizes extremities, secure, comforting, hugging hold for the child. It also allows the patient to still have that close physical contact with the parent or caregiver, because that's the person they're going to trust most, especially during the procedure. It also gives the caregiver opportunity to participate in positive assistance and not providing like a negative restraint. A sitting position can be achieved and promote sense of control for the child, and fewer people are needed to complete the procedure, because you wouldn't be obviously holding a child down. You have the parent providing a comfort hold, but you'd have extra hands in there for extra support if needed as well. So some research shows that parental holding and upright positioning decreases distress in children, increases parental satisfaction, and did not significantly impact procedure success. A family-centered measure that helps promote coping. IVs are the second most common cause of worst pain experience during the hospitalization. Fear, anxiety, and tension heighten a child's response to pain, and painful procedures result in negative memory and greater pain in future procedures as well. So we did have a specialist who surveyed and benchmarks with some of the top children's hospitals across the nation. And it was found that 80% utilized parental presence and positions of comfort when deemed helpful. 85% utilized pre-med when appropriate, and 100% valued child life assessment and considered child life as an essential part of the care team as well. So that's why we definitely like to build that relationship and rapport with our nursing staff, with our physicians and residents, just so that we can build those strong relationships and that rapport, so that way we can overall work together and better as a team when we have to do any types of procedures or tests, or overall just for patient and family-centered care as well. So like I had said earlier, these are just some different images and what some particular comfort holds can be for certain ages. So this one is more so utilized for infants and toddlers, which is the shoulder hug. So you would have the child sitting on your lap facing you, wrap the child's legs around your waist, and support his or her head looking over your shoulder as well. So that could be great for if they have to do a nasal swab, that in particular nowadays, of course. It could even be something if they need to do something in the front of the face, whether it could even be sometimes eye drops or things like that as well. Another common one for toddlers and preschoolers is the sideways lap sit. So you would have the child sit on your lap facing sideways or next to you on the bed, and secure the child's arm with your arm, or your own arm hug. So this could be good at position for if they have to get any shots. I know this one says towards anesthesia machine, so it could even be for if they do have to get anesthesia, even for doing vitals and things like that. Having a child sitting on a parent's lap like that can be helpful too if you have to get a blood pressure or do the pulse ox, anything like that as well. And then preschool teen could be a supine hold or a comfort touch at the head of the bed. So the supine hold position, it works best if a parent is already laying in bed with a patient. Otherwise, comfort touch at the head of the bed while the patient sits or lays on a table is also beneficial. I know we definitely try to utilize this type of comfort hold a lot more, just because we have the parent involved, but also they're providing that comfort hold up top, but also at the bottom as well. And it definitely seems to work a lot better, especially for those age groups as well. So one voice is super important when doing any type of test or procedure, even when there's a lot of people in the room trying to round with the family or have a conversation, one voice is really important. So it's one voice. The voice stands for validate for the V, validate feelings, offer, which is offer like positions of comfort, individualize, so individualizing a comfort plan, choose, so giving a choice in any distraction tool or any distraction they may want to engage in. And then E for eliminate. So eliminate any extra people, especially if the patient is already super anxious and is already fearful of having so many people in the room. How we're going to make that a less stressful environment. And if people who are in there don't need to be in there, just being respectful of doing what's best for the patient at that time. And maybe coming back afterwards and assessing later. This is a video that if you guys would like to see, I think it is a great description. It kind of shows beforehand what it's like without having one voice present in the room with a procedure, and just kind of shows what it's like with using one voice during a procedure, and just kind of recognizing the differences between it, I think is a really good thing to see, and just kind of remind yourselves when in those situations as well. Don't think I can click on it though.
I don't know. I'm seeing if I can get it to play from my end, and let's see.
Okay, I know before I had to
Copy this.
even just on YouTube, it's just called One Voice Makes a Difference by Debbie Wagers. That kind of came up for me too before. It does give me the choice now to screen share. Do you want me to try that and see if it'll play from mine?
Yes.
Did it pop up for you guys? Okay, cool.
I think you need to go down to where it says enable sound and click on the sound so we can hear it.
Oh gosh, I'm sorry. Where does it have it for you guys? Even just looking, if you could see the video, kind of the chaos in the first scene versus kind of the calm, more relaxed environment in the second one. But with that first one, you know, the provider came in and just grabbed the patient from the dad, laid him on the table. Everyone was talking at the same time. And the child was already crying. There was distraction that was trying to be provided at the bedside with the bubbles being blown. But just overall, there wasn't a comfort position that could have, there was a comfort position that could have been offered for a family member. There was a lot of people in the room, so even having some of the people step out if that was going to be more helpful. Having that specialist right next to the patient and the family member too, where the patient could actually see, could also be helpful. And in that second one, you know, the comfort hold was being provided. The specialist talked about the patient's, you know, important roles of keeping their arm really still, and also giving him a choice in distraction was super important as well. So, I guess I can share this and just finish off the slides. Okay. So what we had kind of talked about before with, you know, the one voice of making sure that there is that one voice, that one coach during the procedure, because a lot of voices, everyone talking at the same time or trying to do other people's roles can be super overwhelming for a patient. I know sometimes even for me as a specialist, it can be super overwhelming if we have, you know, a few nurses in there who are trying to distract, but also trying to hold, and everyone kind of talking at the same time. It can be creating a more stressful situation, more than a less anxiety-stricken one. So just be aware of your own voice, tone, and facial expressions. Speak in a calm and quiet manner, and try to stay positive during that time too. If you're doing a great job holding still, you're doing a great job of doing your job. Remember to take your deep breaths. So that's why we do like to, you know, have child life present in those times to be that one voice. And sometimes if the child is reacting better to just having the parent talk, of just stepping down and having that parent be that one voice too is super important. And these are just some different developmentally appropriate distraction items that we like to utilize. From toddler, preschool, all the way to teenagers. So for usually 1 to 4-year-olds, using like a light spinner, we usually use like bubble wands if we have those accessible, any type of music or song, especially if that's what they react best to. For school age, definitely practicing our deep breathing, counting, giving them a stress ball to utilize, giving them a choice in their distraction, whether it's an interactive game, if they just want to focus on deep breathing, if they want to look at an interactive book. And kind of the same with teenagers too, of just providing that opportunity for giving them a choice of deep breathing, engaging in a game, listening to music, just talking sometimes can be most helpful for them. If we have like a stress ball or anything they can utilize to squeeze onto as well can be super helpful. And then I'll just kind of open this up if you guys have any questions or anything else that you guys have.
Yeah, is there ticket in for today? I had them send me some questions, and I think one of the themes was definitely wanting to have you share maybe a special memorable story of maybe a time that a child came in and was really stressed, or a parent situation that you really felt like you stepped in and, you know, something really memorable that maybe you could share with us.
Okay, yeah. There's certainly a lot. I guess I could just think of one even from yesterday as well. One of the nurses had called me and said, you know, they just had to do a nose swab on a 4-year-old. And that already was super traumatic for him. And they didn't even do any type of comfort hold or anything for that. So after already kind of doing a procedure on him and not having child life present, they had called afterwards and wanted me to be there for an IV placement because he also needed a new IV. So I had the opportunity to go in and talk with the dad beforehand. And dad was also like very stressed and anxious because of all the things that they just had to do for the patient. They also had to put like a nasal cannula on as well. So that was also pretty traumatic for him as well, dad said. So just talking with dad if he was comfortable providing a comfort hold, or if he just wanted to be present at the bedside, what he thought would be best for the patient and for him as well. He did say the first time the patient did get an IV, it was really stressful for them as well. And he was flailing and just not a good situation that they were in. So just kind of talking with dad beforehand. The patient was asleep at the time, but dad was able to wake him up and we just kind of talked with him. I showed him what the IV catheter looked like, and just provided more like developmentally appropriate language for the nurses would be coming in and would be placing an IV, which is a little medicine straw, and had him feel the medicine straw. But also saying there will be a poke when you get your straw, but that poke won't be in there forever. So just, reminding them of that as well. Once they feel that poke, that needle, that can be the biggest misconception, is that the needle stays in their arm. So sometimes, especially for school agers, even asking them, do you want to see what the poke looks like and what it will look like in the catheter and what it will look like without. So that's also something to do during our preparation, that we like to give them a choice of if they want to see something like that or not too. For this age though, I just showed him what the IV catheter looked like. But we were able to talk beforehand. He was already wanting to engage in the distraction items that I had. So when the nurses came in, he was excited, showing them his light spinner and showing him the books that I had. They ended up just having the patient lay in the bed, and dad was just at the actually at the foot of the bed and was engaged in distraction with me already before we even started the procedure. So already it was a super calm environment. I think there were 2 other nurses in there, and they were also utilizing the ultrasound machine as well for the IV placement. I don't know if you guys have seen that before, but that's just an easier way, I feel like, for those IV placements, especially getting in on the first try. So we had one of our RNs who specializes in the ultrasound IVs come in and do that for him. So she was also great of saying, okay, I'm going to put the cold gel and then we're going to look at your arm for where your vein is, and had him involved in that. But he was easily engaged in the distraction during that time. And we told him beforehand, okay, we're going to have a poke. So I had him just focused on me and said, can you take some deep breaths with me? And I said, blow in through your nose and out through your mouth like you're blowing out your birthday candles. And he closed his eyes and we did that 5 times and he did great. He did that throughout the whole time they were doing the poke and even afterwards too, and was ready to get back into play when we were done. So the nurses afterwards just kind of looked at me and were like, I was not expecting that just from the previous experience they had, but also, they definitely had to do a more invasive thing with a nose swab, and also probably held him down for that time, didn't have a comfort hold with them. So it just showed, even though you were just with this patient, those different things of those quick changes of providing a comfort hold and distraction, preparation, all that stuff helped in this situation and overall made it a good experience for the patient and family. So.
What about a time where you had to discuss a difficult diagnosis, like a bad prognosis or something? How do you support families during that time?
So being on the general inpatient pediatric unit, I haven't had to do that super often. But we do work with children of adult patients as well. So those can definitely be a lot of difficult situations. So if a child has a parent who is here in the hospital and has a poor prognosis, or is going to be transferred on to like palliative care. Kind of having those conversations can be really difficult as well. But again, just talking with the loved ones of those family members, how the children learn best and how they react best to certain things is super important. I guess now that I'm thinking more, we do have a few kids who we've had who have just got diagnosed with like Crohn's disease. So I guess that was a little bit of a difficult situation. I think the patient was about 12 or 13 and already being here in the hospital, like did not like any type of loss of control, got really anxious and mad and fearful when we had to do any types of pokes or any types of IVs. He also hated not being able to eat anything for a while as well. So it was actually a lot more conversation with the parents because they weren't sure how to explain what Crohn's was and why he was actually here in the hospital. So providing a lot of resources for them was super important, but also talking with the patient about the body and how the body works was helpful, but it was definitely a long few weeks of him trying to figure out why he's here, why he can't eat certain things. So we had to take a lot of time and patience of explaining, what certain tests were and why he couldn't eat certain foods. And we actually ended up ordering a lot more books to kind of help explain Crohn. And then also talking with our other specialists in the outpatient areas too, of this patient may be coming to you. This is where the patient and family are at right now and how they've explained patient's diagnosis. But I think these things could be helpful if he does have to come for an outpatient visit, of providing preparation before an IV and using a J-tip and kind of passing on what has worked best with these patients as well.
That's really great. Thank you for sharing those stories. Another theme of some questions that were asked had to do with your own self-care. Like if you're dealing with, dealing with kids' stress and stressful situations all day, how do you kind of go home and care for yourself?
Yeah. So even from the start, I know that was kind of a hard thing to keep work at work, and when you're going home, you just got to keep work at work. So I've definitely learned that, working out for me is definitely a stress relief. Also, any type of relaxation, whether it's like going for a walk or any type of meditation or yoga, things like that is super helpful. I think even having a really close-knit child life team as well, since there is just a few of us, and having a really supportive manager is helpful, because after difficult situations, sometimes it's just like, well, what just happened? So just having supportive people to talk to can be super helpful, and having those conversations at work and then having that relief of, okay, I got that off my chest. I'm able to go home and kind of focus on what's next is super helpful. So for me personally, yeah, just trying to be active and work out, but also if there's days that are super exhausting, just knowing that I just need to rest and relax, and just listening to your body is super important too.
I like that, pointing out the importance of having a supportive work environment, because you're right. If you have that support at work, then you can leave it at work. You can go home and have your home life, kind of keep it separate. I like that. I think the students have noticed that going to Banner for clinical is that there is a very supportive work environment there among the staff and among child life. So
For sure.
I'm glad that they're able to see that, demonstrated in the work environment.
Mhm.
Yeah. So any specific tricks that you can think of for them as new nursing students, things that they might, you talked about, just explaining things to kids, preparing them, involving child life, using, thinking about pain, preventing pain.
Right.
So
Yeah. just utilizing the resources that you guys have is super important. And also for when you are here for clinicals, just kind of maybe recognizing a flow of, there are times when you might be in a procedure and we might not even be called because those situations do happen. But for you as, nursing students, but also for when you guys are nurses as well, of just being an advocate for the patients and families, but also like when you are doing assessments with patients, just recognizing again, like how many people are in the room. If, the nurse and someone else is talking, is there some input that you could have for providing a comfort hold, or if they haven't thought of that. But again, yeah, just providing the best support you can for the patients and families is super important, and just recognizing the environment you're in. Each room is going to be different, especially with the family dynamics, how the patient reacts, their ages and things like that. But what's the best way that you can support them during that time, and what's going to be like the least stressful and most appropriate way to make it a positive experience for them.
What are some of the specific stresses that you think kids have experienced with COVID, and things that have changed your ability to, function in your role as in child life because of COVID, like not letting kids go to the playroom, or, you still have like a toy reward room, right? But you just bring the toys to them after a painful procedure. What have been some different approaches? And isn't it kind of interesting how kids are smart, right? They understand the whole mask thing, and, but are there specific things with COVID and the pandemic that you've seen that kids perceptions on it?
Yeah, and I feel like a lot of it can be from the parents' perception on thing, especially for younger kids. I know when for a while during COVID, we had not enough patients to have this D5 unit open. So we were combined with the PICU area, and you could already tell the stress of people even coming to the hospital. Parents were already super anxious. And of course, not a lot of people knew what was going on. So having everybody masked, or having, the big N95s and things like that, a lot of the fear from the parents, it seemed to be, especially for the younger kids, especially if they hadn't left the house, they're not used to interacting with people. Or I remember we had a 9-month who ended up being a new diabetic, and the mom said she's just not used to being around people. So this is going to be a whole new environment, because there were so many people who needed to be a part of their team as a new diagnosis for diabetes, even that, it was a fear of, helping normalize. Okay, well, let's bring in some toys to, make sure that they have the opportunity to play while they're here, and show that each person who comes in can be a trusting person, but also what they're doing during those times as well. I feel like for a lot of older kids, sometimes even not being able to, even outside of the hospital, they weren't able to go to school or interact with other kids. And unfortunately, we couldn't have those opportunities here as well. Whereas before COVID, we were able to have like a lot of kids in the playroom or in the teen room and able to interact or go to special events and things like that. So you could tell everyone was even staff. I mean, sometimes we could be a little bit more timid of what are they comfortable with, and how can we make this a positive experience for them, but also help normalize by still providing activities, and follow-up support as well is super important too. But yeah, you can definitely tell that there were a lot of stressors before, especially with parents, that could definitely reflect on kids as well. I know sometimes even the fear of walking out in the hallways could be some things for families, especially if a kid had, an appendectomy. It's really important that we get them up and walking. But sometimes they're like, are you sure we can go out there? We're like, yes, just make everyone's masked. Just make sure you wear your mask, and we'll get you some socks. You can wear gloves if you want, and just stay on this unit and go for a walk. So just making sure we're supporting them, but also, reinforcing them like, yes, this is a safe environment and it's okay to do these things because it'll help you in the long run get home sooner and help your body heal faster too.
Okay, so class, any other questions from any of you? I know I'm not going to go through, each question that you posted, but if you have something that you really wanted asked, now's your chance. Go ahead and raise your hand if you know how to do that on the icon below. Or you go up on your little dots here to the right. Or just unmute yourself, whatever works. Any questions? No, that pretty much answered everything. Okay. Are there ways, are you taking donations for specific things? Do you like new books and toys and things for the kids?
Yeah, so right now for our donation process, we are only accepting things that are like brand new packaged, brand new items and stuff. Books are always helpful. Toys for infants all the way through school age, super important. Even teens, like adult coloring books and things like that, we're always looking for. So anything really.
Okay.
Yeah.
Do you have any fun things planned for Halloween for the kids?
We are hoping to do a reverse trick-or-treating. Usually every year too, we get donations of little Halloween goodies. Spirit Halloween also works closely with our Child Life team. So if you do go to Spirit Halloween, 10% of that goes to our Child Life team, but they always donate costumes every year. So we're able to offer costumes for all of our patients who are here over Halloween, and have fun like arts and crafts and things like that for them to do too.
How many nurses do you think get jealous of your role? Do you ever get that where they're like, I wish I could be Child Life?
Sometimes, yes, but sometimes they're more so jealous, like, oh, I just want to play all day. And it's like, well, just play with a purpose. Just playing just for fun, but also playing to do my assessment and recognize where they're at developmentally. So also reinforcing them that. But yes, there are some times when I'm like, oh, I should have gone
Right.
into Child Life.
So someday I want to make a t-shirt for you guys saying, who you calling play lady, right? Or
Yes.
don't call me for the Nintendo or, like all those little things that you guys get labeled with. I want to make
Oh,
a t-shirt
exactly.
that dispels all those myths,
Mhm.
Yeah.
For sure.
Because you certainly do have, that background, that expertise. And, this is so important during this time. They're really focused on child development and those different developmental levels. And sometimes they're very specific, right? So I think this was good for them for the students here to have that, specific interventions that you do for each age group as the child is developing.
For sure. And for a lot of our kids who are even developmentally delayed, just recognizing, okay, they could be 13, but developmentally right now they are maybe at like a 3 or 4-year-old. So we have to bring down our interactions with them to like a 3 or 4-year-old age developmentally appropriate way. So
yeah, exactly. And sometimes when kids are stressed, they behave different ways. So I found it's really helpful to bring in people with different views, expertise, have Child Life involved and see what their input is into what they think is going on with the child developmentally, your therapies, your physicians, different members of the team all have different, when they're in the room, how did the child behave, because when the nurse goes in, they could just be stressed because the nurse is going to do something to them.
Right. Yeah. And because we are here Monday through Friday too, we get to build that rapport with the families, especially if they are here for a few days. And, with having different nurses each day, sometimes you may have the same kiddos like a day or two in a row. But just being that consistent person and just kind of knowing, oh, well, yesterday we did an IV and this is how this went. So when we do this blood draw, I think it would be important to do this. So just being able to be that go-to person as well can be super helpful of how they reacted before and what they were like and what was best during those times can be super helpful too.
Very good. Well, if there's no other questions, I think that was really good. I'll make sure that we watch those videos. I'm sorry for the technical difficulty.
Oh, no worries. I'm like, I don't know how to share the sound, but
Yeah, and I know it's difficult. You got to go back, share sound and then go back and share the video again. And it's kind of back and forth. So we'll get it figured. It's easier in the classroom, but it certainly is convenient to have you pop in on Zoom. So taking advantage of the technology, and I'll have the recording for the students. So that'll be good.
Perfect. Well, thank you
Okay.
guys so much. Hopefully
Yeah,
this-
we'll see you on Fridays. Watch for us. You know, we
do.
still have a few more groups of clinical groups coming through on Fridays. So
Okay.
make sure we
Yeah,
say
and
hi.
if you- Perfect. Yeah, and if you see me around, if you have any other questions, feel free to let me know.
Yeah, and we'll definitely key those nurses in if they're going to do any painful procedures. We'll be like, did you call Child Life?
Perfect.
Right?
Sometimes
Megan,
I
thank
need
you
a little-
so much. Thank you very, very much for coming in, talking and
You're
sharing your
welcome.
expertise with us. And just want everybody to wave and
Guys.
say thank you.
Appreciate
Right?
it. Yes, hearts back.
Yep. So thank you so much.
Welcome. Have a good rest of your day.
Yes, you too. Thank you.